Hi everyone, and welcome to Allen County Health Department's Diabetes Drops, our short educational videos to help with diabetes management. Today we will be doing an overview of diabetes prevention and control. In this video, we will discuss what is diabetes, the two main types of diabetes, recognizing high and low blood sugars, target A1C levels, and the ABCs of diabetes. So what is diabetes? Diabetes is a chronic health problem that affects how our bodies use glucose, or sugar, for energy. Over 38 million people, or 11.6% of the US population, have been diagnosed with diabetes. 1 out of 4 of these people did not know they had diabetes before they were diagnosed. When our bodies are functioning normally, the food we eat is broken down into carbohydrates, proteins, and fats, and is absorbed into our blood for energy. When we eat, a signal is sent to our pancreas to release a hormone called insulin. Our bodies need insulin to help sugar from the food we eat get into our cells to be used for fuel. Insulin acts as a sort of key, represented here in the red, allowing sugar, known as glucose, represented here in the green, to enter the body cells to be used for fuel. Here you can see the key, insulin, represented by the pink flower, attaches to the blue cell receptor and opens the cell so that sugar glucose can enter and be used for fuel. When you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes very well, causing sugar to build up in your blood instead of going into your cells. There are two main types of diabetes, type 1 and type 2. There are other types of diabetes, but for the sake of this video, we will only be focusing on these two. Type 1 diabetes is considered to be an autoimmune disease. This means that something has gone wrong and the body's immune system, our infection-fighting system, attacks the body's healthy tissues, and in this case, it attacks the pancreas until it can no longer produce insulin. Without insulin, glucose cannot enter cells and builds up in the blood. If too much glucose builds up in the blood, it can become life-threatening. Type 1 diabetics must have insulin injections for the rest of their lives to survive. As a person with type 1 diabetes eats, some of their food is converted to glucose. Their pancreas no longer makes insulin, the key to opening the cells, so glucose builds up in the bloodstream, causing many serious issues. With type 2 diabetes, there are several problems with the body's ability to manage blood sugar that occur. Insulin is still made by the pancreas, but sometimes it's not enough insulin to move the sugar into the cells. Sometimes the person with type 2 diabetes becomes insulin resistant, meaning that the cell receptors or doors of the cells no longer respond correctly to insulin, so the glucose cannot enter the cells to be used for fuel. With this type of diabetes, when a person eats, blood sugars rise, some insulin is produced and tries to open the doors of the cells. Some sugar gets into the cells, just not enough, and sugar builds up in the blood. As you can see here, the pancreas has made insulin, but it's not enough. And in some cases, the insulin may not fit into the cell receptors, like a key not fitting into the wrong lock. It's important to know which type of diabetes you have. This represents a person with diabetes. You can see there's no insulin to activate the cell receptor to let the sugar into the cell. For those who have not been diagnosed with diabetes, here are some signs and symptoms to be aware of. Increased thirst and hunger, feeling like you have to urinate more frequently, feeling more tired and lethargic, having blurred vision, wounds that take longer to heal or that won't heal at all, unexpected significant weight gain or weight loss, and having numbness in your hands and feet. Blood glucose before eating for people without diabetes should be between 70 to 99. However, blood glucose levels for those who have been diagnosed with diabetes are different, and target ranges should be individualized. Work with your healthcare provider to find out the right range for you and your body. Typically speaking, however, diabetics should try to keep their blood glucose levels between 80 to 180. Fasting blood glucose, or before meals, targets should be roughly between 80 to 130, and people should have a blood sugar target range of below 180 after meals. Make sure to speak to your healthcare provider to find out your target range before bed. So we just talked about blood sugar target ranges. Now let's look at how we can determine when we are out of range and how to prevent or manage our blood sugar highs and lows. Hypoglycemia, or low blood sugar, is defined as blood sugar 70 or lower. Someone taking insulin or diabetic medication may be prone to having low blood sugar reactions. There are many other causes for low blood sugar as well, such as not eating enough food, being more active than normal, drinking alcohol can lower blood sugar. Some medications can also lower blood sugars, either purposely or as a side effect. Taking too much insulin or medication and some antibiotics can also lower blood sugars. Signs of low blood sugar include shakiness, feeling dizzy, sweaty, or numb, having headaches, feeling unusually tired, weak, or irritable, frequent mood changes, increased heart rate, or you may not have any of these symptoms at all. Low blood sugar can be serious and should be treated immediately. If you think you have low blood sugar, remember the rule of 15. First, test your blood sugar. If you are not able to test blood sugar levels and you have symptoms, treat as if it is low. You will want to treat with 15 grams of fast-acting carbohydrate, such as a hard candy like peppermint candies, a tablespoon of honey or sugar, glucose gel or glucose tablets, a half a cup of fruit juice or soda, or a cup of skim milk. You want to avoid foods that contain fat or protein. These foods will take longer to work, and you will want quick-acting sugary foods. After taking 15 grams of fast-acting carbohydrate, wait for 15 minutes and test blood sugar again. You do not want to overcorrect, so it's important to stop at 15 grams and test in 15 minutes. If blood sugar is still low after testing again, take 15 more grams of carbs and wait to check again. Repeat this until blood sugar is out of low range. Preventing low blood sugars by eating meals and snacks at regular times, increasing food intake if activity or exercising is more than usual, make sure to always eat if drinking alcohol, and always carry emergency fast-acting carbohydrate foods with you. Hyperglycemia, or high blood sugar, is defined as blood sugar above your target range, measured 1 to 2 hours after eating. This is more individualized and may be different. It may be a different number for different people. Talk to your healthcare provider about your target range. High blood sugar can make you feel bad, and if it persists, can cause long-term complications such as heart disease, blindness, amputations, kidney problems, or other issues. Causes of high blood sugar include overeating, sickness or stress, not taking enough insulin, missed routine exercise, or missed medications. Symptoms of high blood sugar are the same as low blood sugars, so it's important to test blood before treating. If the cause is known, such as missed medication or insulin, correct it. Make sure to drink more water and do not exercise. You may also want to check urine for ketones. If blood sugars are consistently too high, contact your healthcare provider. Hemoglobin A1C is a blood test that measures the amount of glucose attached to hemoglobin, which is the oxygen-carrying part of your red blood cells. And this is done over an average of 3 months. The higher the amount of glucose in your blood, the higher the amount of sugar that sticks to your red blood cells, which also means the higher your A1C will be. Having consistently high blood sugars will increase your A1C levels. Keeping A1C level in target range can help to reduce the risks of complications associated with diabetes. A1C targets should be individualized, but typically speaking, A1C levels lower than 7% is a good goal to shoot for. A1C at 7% means an average blood glucose level of 154. Higher or lower A1C range may be right for you. Talk to your healthcare provider about your goal range. Managing diabetes means more than just managing blood sugar levels. We often talk about managing your ABCs. A stands for A1C. Keeping A1C levels in target range is important for preventing long-term complications of diabetes. High A1C raises your risk of blood vessel complications like eye damage or kidney damage. As A1C levels decrease, so does your risk of complications. B stands for blood pressure. For a diabetic person, a target blood pressure level is less than 130/80. Based on your age and other health conditions, a lower blood pressure may be recommended. C stands for cardiovascular risk factors, such as high cholesterol, heart disease, being overweight or obese, smoking, and high triglycerides or high blood fat levels. It's recommended that your healthcare provider look at your score on the risk calculator from the American Heart Association. This will give a prediction of your cardiovascular risks. A good target for total cholesterol is less than 200, with HDL, or good cholesterol, over 40 for men and over 50 for women. The higher your HDL cholesterol, or good cholesterol, is, the better. Speak to your healthcare provider about possible risk factors and your risk factor score. If you have any questions, or if you are interested about learning more about diabetes or our diabetes prevention and control program, contact Allen County Health Department at 270-237-4423 or go to our website at allencountych.com. Diabetes can be a complicated disease, but the good news is you don't have to fight it alone. We're here to help and support you. Give us a call today. Thank you for watching this video. Take care.